Good afternoon, everybody. I am Commissioner Slatton Hodges. I am the Commissioner here at the Department of Mental Health and Substance Abuse Services. And I'm coming to you today to talk a little bit about 988 in Oklahoma and a little bit further into our upcoming crisis continuum of care. So what we're going to go over is what is 988, how it works, mobile crisis teams, urgent recovery and crisis centers, how 988 will impact Oklahomans, give you some resources and how you can connect with resources, and then do some question and answers at the end of that. So what is 988? The year before last, our federal legislators passed a bill that said they were going to create a 3-digit number for persons who are in mental health crisis. And that bill was passed, and the number was designated as 988. Well, what does that mean? What it truly means is that the National Suicide Lifeline Prevention Network call number would change to 988. And in some states, that would be what happens, is that 988 will be the number that now connects directly to the National Suicide Lifeline Prevention number. In Oklahoma, we saw this as a huge opportunity to not only connect with our National Suicide Lifeline Prevention number, but to build a continuum of care around that. Now, some of this will go into place in the next few months, and some of it will be things that we will continue to build over the next year, the next 2 years, the next 3 years, as we identify needs and challenges and can have a continual source of improvement as we go along. So the purpose of 988 is to have a quick, easy to remember number for persons to call when they are in need of care. And what this will do here in Oklahoma is connect you to a full continuum. And one of the things that people don't often realize is that in Oklahoma, we have higher than the national average rates of suicide. And that cuts across both youth and adults. And we have high rates of people who do go into crisis and avail themselves of some of the systems that we do have in place. And some of the systems that we do have in place really, as we went through COVID times, started to become overwhelmed. And what we knew is that we needed to continue to build on this system, continue to layer in additional ways to respond to crisis in our state, and also make a crisis continuum available to more Oklahomans and in more areas across Oklahoma. So we are leveraging our existing pieces that we have and continue to add pieces and to keep up and make sure that we're at national standards and best practices around each component of a crisis continuum of care. So one of the things that 988 will do, and there's many things that it will do, is that when you call 988, there will always be someone to talk to. Now, if you're in a psychiatric crisis, there will be behavioral health professionals who can talk to you and try to resolve that crisis via that call. So if you will, brief therapy that can happen over the telephone to make certain that your needs are being met then and there. And what we know nationally is that the majority of these situations can be managed over the telephone, which is a fantastic thing. Now, what we group that has been in Arizona for the last 15 years, running a call center and funneling people through this crisis continuum of care in Arizona. And by the way, Arizona is often held out as having the most complete and best crisis continuum in the nation. Now they're continuing to build on theirs as well, but what we do know is that they have been ahead of other states. And so in partnering with Solari already had the technology and the capability to manage this high volume call center, to be able to book appointments, to be able to dispatch mobile crisis teams, and do all of the things that we wanted in Oklahoma. Something up that says technical difficulties. Okay.
Test.
Okay, good. I got a thumbs up. I'm going to go back through this slide because I'm afraid some of you may not have been able to hear what I was saying. So we have partnered with Solari. Solari is the highest volume call center in the country, taking over 20,000 calls per month in Arizona. And they are coming here to Oklahoma. In fact, they're here. They have hired staff. They have found a spot. They've brought their technology, and they are ready to start manning 988 in Oklahoma. So one of the things that you will have in addition to calling the lifeline of 988 is it will also have text capability. So that is pretty exciting as well. And so this will just be 3 digits away for you or your family members who are experiencing challenges and need someone to talk to. Some of the things to expect when you do a call or a text, number one is that these are answered rapidly. Within our contract, we have high expectations in terms of what the answer rate will be, the amount of time, and this is literally seconds. They'll ask a little bit of information from you, your name, your birth date, and your phone number, And then they'll start assessing what is happening. They'll start asking you some questions about what your current risks are to know the level of intervention that may need to take place. You can remain anonymous on this call if you like, and the information that is provided to you is private and confidential. But you don't have to wait until things have escalated to such an extreme. You can call this line for help before you're having active thoughts of harming yourself or anyone else. So we want it to be a resource for everyone. You can also call as a third party to get information or to get some guidance or resources for another individual. So we have a wealth of opportunities that will be available through this line. One of the things that will happen is through the call, if the person is not able to have a great resolution to the crisis that they are experiencing, there is the opportunity, if it is deemed appropriate, to dispatch a mobile crisis team anywhere statewide to come to you to say, we're here, you needed someone face-to-face, you knew we were coming, and here we are. We're going to sit down and we're going to work further through the things that are going on to come to a resolution. And we also have the ability to make follow-up appointments for you through 988. So if a person calls in crisis, say the crisis was not able to be resolved over the phone, then you may have mobile crisis teams come out to you to further sit down and talk and de-escalate. And then that mobile crisis team or the call center, whichever one is happening at the time, can make you follow-up appointments. They're also going to connect back to make sure you made your follow-up appointments, to see if you're feeling better, are there any additional needs. Do you have any barriers to your appointment? Do you have transportation needs? Or is there anything that is interfering with your ability to get your ongoing help? And help resolve those for you. And so you think, well, what is a mobile crisis team? Well, a mobile crisis team can be dispatched by 988, and that is a clinician and a peer recovery support specialist or case manager. Well, some of you may not know what a peer recovery support specialist is, so I'm going to take a moment to tell you about that. A peer recovery support specialist is someone who is in recovery themselves. So they have walked in your footsteps through either having had an addiction issue that they're in recovery from, or having had a mental illness that they sought help for and now have continued on after the crisis and have a meaningful life in the community. And one of the things that's so helpful about a peer recovery support specialist is they can connect with folks in a way that says, I have been exactly where you are today, and here's where I am now. So they are a beacon of hope. They also can share the experience that they've had, how they felt during this time, and also alleviate a lot of the fears that people may have with a system that this may be the first time that they're engaging with. Utilize best practices around suicide prevention and intervention throughout the entire course of this, whether it be through the call center or the mobile crisis team. And 988 will be the dispatcher of these teams if that is where you call, and we will have availability throughout the state for these teams to come to you when needed. So again, we talked about making a follow-up appointment, and then even transportation needs. One of the things that we have done at the Department of Mental Health is our legislatures passed, not this session we just ended, but the prior session, a bill that says whenever law enforcement was designated as the transport entity and that trip is greater than 30 miles, the Department of Mental Health will be responsible for transportation. And so we put that into effect November 1st of this previous year. And so when a person needs to go for a higher level of care or greater than 30 miles for an evaluation or crisis care. One of our contractors is who does the transportation. And so in those cases, you no longer have to be handcuffed and put in the back of a police car to get the medical help that you need. You will be transported in a vehicle that is anonymous looking, that is safe, that has trained folks driving. In fact, oftentimes peers are who you'll be enacting with, who are getting you where you need to go and who are able to talk to you on the way to explain to you what will be happening next. And we've partnered with a couple of our CCBHCs who do transport in their area, and it's just been phenomenal. Now, another piece of the crisis continuum of care that is incredibly important is urgent recovery centers and crisis centers. So when you think about an urgent recovery center, if you think about when you have a medical condition, sometimes you go to the emergency room. Think of these as the same way, but for behavioral health crises. So when you go to an urgent recovery center, there are persons there 24/7 to assess what is going on and to start treating what it is that is going on. They offer a no wrong door approach for mental health and substance use care. Folks can be brought there by law enforcement, by friends, by a neighbor, or themselves can go in and say, hey, I'm not doing great and I really need to talk to someone. And these locations are there to help you. Now, what we've been doing as part of our crisis continuum of care is to add more and more of these throughout the state. And our goal is to have one in each community so that you never have far to go to receive face-to-face 24/7 care within reach of you. This map shows existing and our new urgent cares and crisis centers that are happening this fiscal year throughout the state. The blue designates the new, and as you can see, we are adding a lot. We will continue to add these each year until we have the capacity needed around the state to have an easy means to have a face-to-face intervention when you need some psychiatric or addiction care. These are really a phenomenal thing. They have tremendous outcomes. What we have seen is each point of our crisis continuum of care has the ability to resolve crisis and to keep people from needing to go into a hospital stay or to a longer episode of care away from their home, their job, and their community. So when you call 988, the majority of those calls are going to be able to meet that person's need and connect to outpatient care. Mobile crisis is another means by which people are able to have their needs met and be right back to the community in outpatient care. The same is true with urgent cares, and then that last layer is a crisis center. So if you really do need a stay to help resolve the issues that are happening, say if you are a person that is experiencing psychotic symptoms to the point that they are innate or disabling you so that you cannot work, you cannot function appropriately, you may need a crisis center stay to get you on medicine, to get those symptoms down to a point where you can go back and continue in outpatient care with your life. And so that really is the final step in the crisis continuum of care, with the exception of about 20% of people who make it all the way to needing a crisis center bed, then go on and need a hospital stay. So when we talk about resources, there is a website that you can go to, which is www.988oklahoma.com, that will tell you more about this and also go over some of the things that we've talked about today if you want something at your fingertips. And when you do that, there will also be a place you can click on to get help immediately. So you have the options of texting, of calling, of going to a website, all of these different ways by which you can connect with someone to help get you back living your best life. You also can connect on Facebook, I'm not going to be able to know all of these. I'm not sure what the little ghost figure is. I'm sure some of the cool kids know. But these are other ways that you can connect with 988. And you can follow them on social media, get updates and information from them, and be able to have at your fingertips additional ways to connect. So with that, I really want to see if we have any questions at all that I can answer. And I do want to apologize for any technical difficulties that we had today. I hope that you were able to hear the information and hope that it will be useful to you in the coming years.
Commissioner, we had a question in the chat from Whitney. And her question was, can mobile crisis teams directly transport people to URCs?
That's an excellent question. When it is safe and appropriate, they absolutely can. And in fact, what I would view as that would be pretty common practice. But if it is a person, if the mobile crisis team has gotten there and the mobile crisis team has decided that this person's risk is too high to stay at home and they really do need to go to a higher level of care, and the person is not willing, then that would not be a time for mobile crisis to do that transport. We'll call in for more trained transporters. But anytime a person is willing, wants additional help, and additional help is the appropriate course of action, mobile crisis can transport.
Commissioner, we also have a question from Jordan asking, will Solari be the only center answering 988 calls in Oklahoma?
So Solari will be the umbrella call answer, and then we have two call centers underneath Solari, which are 988 which are National Suicide Prevention Lifeline answerers. So in essence, Oklahoma will have three, but in order for them to all funnel through one single point of entry, they'll all come through Solari, and then those others will serve as additional resources.
Thank you. We also have a question and a comment from James on the URC map. If we could maybe pull up the URC map. We're working on that right now.
We'll get back to that map for you, James.
So the question is, Commissioner, when James looks at the green dots that say existing, so the URCs that are existing on the map, they're primarily outpatient counseling centers, which are not necessarily urgent recovery or crisis centers. Can you elaborate a little bit more on that?
Yes, when we get the map up. So what you may see is that there may also be an outpatient clinic there, but there actually is a designated URC. There we go. So, for example, on any of these, when you see these locations, there may be additional services there, such as outpatient or even inpatient or crisis unit, but we have added the component to these locations of having a walk-in 24/7 capacity to provide immediate care. So you'll see overlap in that.
Awesome. Thank you. Any more questions anyone has, please feel free to add them to the chat. We also have some questions, Commissioner, just some general questions about 988. So who necessarily will be answering the calls? What kind of training will they be given?
So everyone will be trained as a crisis call center counselor. So that is a benchmark that the National Suicide Lifeline designates as a training for any and all people who answer calls throughout their system. So everyone will have that training. In addition to that, there will be licensed mental health professionals that will be able to do a number of things. One, really evaluate the level of crisis or need that is going on to assess for any type of risk for that person. And also, in order to determine whether mobile crisis is appropriate, there's specific training around that. And there are things that maybe you wouldn't even think about before you dispatch a mobile crisis, such as, are there weapons in the home? Is there a large dog? Is the dog friendly? Those types of things. So there's additional training in determining when mobile crisis is a safe, appropriate response or not, in addition to other training. But there is always licensed mental health professionals available at 988, as well as trained crisis counselors when it has been determined that the risk is such that, say maybe you need to go to the warm line as instead. The risk is not such that you need an intervention. What you really need is to be able to talk to someone.
We had a couple more questions come in, Commissioner, from Amy. With the existing crisis centers and current DMH satellite offices, will additional crises staff be hired or at least set aside for these crisis response walk-ins or referrals?
Absolutely. And I can tell you through our CCBHC demonstration that we've had going on with 3 of our CCBHCs who have really kind of started this crisis continuum of care. They've hired an additional, over the last several years, 981 employees. So yes, in terms of mental health and mental health crisis and addiction crisis, we will continue to build that workforce as fast as we possibly can. But yes, there's definitely additional staff being hired.
We also had another question from Whitney. Commissioner, can you talk a little bit about the funding mechanism and how this will be paid for in the future when we don't have as much access to federal relief dollars?
So that is a great question. There's a number of sources that have been incredibly helpful. Number one, our state legislature, not this session that just ended, but the previous, gave dollars to the Department of Mental Health and Substance Abuse Services specifically for adding urgent cares and crisis units. And those dollars went into our base, so those continue to carry through, as well as to fund mobile crisis teams. In addition to that, the federal government added dollars into our block grants as a set-aside specifically for crisis services. So those are means by which we will continue to be able to build our system and fund our system. Now, there, in the 988 legislation that the federal government passed, they said that there is an opportunity if states choose to use it to add a small fee to cell phone services or landline services to help fund this. So that is an option. 4 states have chosen to use that at this point in time. In Oklahoma, we have not needed that to stand up these programs and continue these programs on, but that is an option. One of the other things that is important to note is one of the reasons why the provider that we picked to man the call center was important is that in doing this work in Arizona for many, many years, they have a system by which close to 50% of the calls that they answer, they are able to get Medicaid compensability for. And so they come with that expertise and experience of being able to do a decent portion of their call center operations through third party and Medicaid compensability.
Awesome. Thank you, Commissioner. Again, if you have any additional questions, please feel free to add them to the chat. And in the meantime, I have a couple other questions for you, just general 988 questions, Commissioner. Can you call 988 for someone else other than yourself?
Absolutely. And in fact, as family members and friends and spouses and siblings, oftentimes one of our loved ones may be experiencing a crisis and we don't know how to help them. And you absolutely can call 988, explain the situation going on, and they can walk you through the best way to assist or help that person, whether it is in finding resources or that you do have an existing crisis going on. They can walk you through the steps that you should take at that point in time. So it's a great resource for family members, parents, siblings, etc.
Another question that we're getting from Tony. He says, I've heard that some people have voiced privacy concerns. Will every caller be identified and geolocated?
So that's more of a federal discussion right now. It's my understanding that geolocation does not happen through the Lifeline right now, but it is a debate that is going on federally. And I think it is an interesting debate, really, because if you can use geolocation to save a life, well, you may want to do that. But of course, we in no way want to interfere with a person's privacy or the fact that they called for anybody to be able to have that anything but the utmost of private. So there is an ongoing discussion happening right now federally, and we'll continue to receive federal guidance around that.
Thank you. Commissioner, will 988 and 911 work together?
Yes, absolutely. And I would say one of the things that we did do here at the department is when we did an RFP for a call center, we actually had our state director of 911 services as part of our evaluation team so that he could really ask the tough questions and the capability and understand how this technology would be able to work along with 911. Now, ideally, what we hope is in time is that persons who are experiencing a mental health crisis would call 988 instead of 911. But we realize that's going to take some time. In fact, when 911 first started, it took about 4 years before it really had the level of usage that would seem appropriate for people needing assistance. And so we know that this won't happen overnight, but ideally a person would call 988 first instead of calling 911 when they're having a mental health crisis. Now, if there's something that is immediate life-threatening, of course, that is fine. So if someone's bleeding or someone is harmed, call 911 who can dispatch an ambulance immediately. But we will work closely with 911 so that we can communicate when there is a need for a different type of response in a situation. And we hope that it will work both ways. Now, I can tell you that here in Oklahoma County, for example, we've been working with Oklahoma City PD and meeting monthly to really talk about how this will work and how this can seamlessly happen. We have been asked nationally not to do a tremendous amount of promotion on 988 right now. They have asked that we allow things to get up and running, have some tweaks go on, make sure that things are working as seamlessly as possible before doing a large promotion campaign. So we have tried to do that. It's been a little tough because we really are excited, but we haven't done a public campaign at this point in time. But once we have things rolling and we're certain that we have any back and forths seamless, that we have our mobile crisis teams operating seamlessly, that all of the call center feels very confident about what is happening, then we will start a public campaign. And we hope that it becomes the norm around any mental health or addiction issue, that 988 is the number to dial.
Thank you. We just got a question from Carrie, another Carrie. Do people have a choice of locations to receive care if they are needing a higher level of care?
You know, that's a good question. Normally what's going to happen is you're going to receive an assessment at the closest place to receive an assessment. But if you do have a preference and there is availability at your preference, then folks try to facilitate a transfer. It may not be immediately, because your level of need may be that we've got to start making sure that any immediate crisis needs are taken care of. But there's always the ability to do a transfer if there is space available at your chosen location. And that actually happens now many times. Because what I will say is when we talk about 988, we're talking about any and everyone. You may be a private insurance holder, you may be a Medicare recipient, you may have no insurance at all, you may be a Medicaid recipient. And so, yes, there is a network of opportunities for higher levels of care. Our goal is to prevent you from needing a higher level of care, but when it is needed, we'll try to make sure that is the most appropriate place that you land.
Thank you. We had a question come in from Lorna. They're wondering, how will 988 work with local law enforcement agencies, Oklahoma City and Tulsa come to mind, who have contracted with private entities to provide similar services?
Well, that's a little bit of a vague question, so I'm not 100% sure what they mean by that. What I can tell you, all of our CCBHCs across the state are participating in the mobile crisis component. My guess is that may be where some of those contracts currently exist. The transportation contracts that are out there now, those will remain and stay a part of our transportation component. I'm not sure what else law enforcement would contract for, but if they want to ultimately, maybe even offline, send me something more specific than that, then I can try to answer that question.
Absolutely. I did have a question, Commissioner. If you know of someone who is actively attempting to harm themselves and you call 988 for them, will someone go out to them, or how will that be handled?
So that's a good question. If you know of someone that's actively harmed themselves, first I would say, if there is a person that is in need of immediate medical attention, then you need to dial 911. Now, 988 will dispatch, they will connect with 911 and get immediate medical attention there, but even those couple of minutes could save a life. So if someone is in a situation where they are in need of immediate medical attention, I regardless of whether it is from a behavioral health cause or a physical health cause, you want to get immediate medical attention there. Now, 988 will, through calling 988 and they ascertain that immediate medical attention is needed, they will start that in motion and get medical attention there. But I wouldn't even wait that extra minute if there is someone that has a life-threatening wound or overdose or anything of that nature. I would handle that the way I normally would a medical emergency.
Thank you. Again, just a reminder, you can add your questions to the chat here for Commissioner to answer. We've gotten a couple questions about where to get additional information about the URCs. That information will be listed on the ODMHSAS.org website, and we will work on getting a list of those URC locations in addition to the map?
I will say that the ODMHSAS.org website has a wealth of information. I don't have it pulled up here, but if I did, I'd walk you through exactly where to find that. When you get to the website, I believe it is under, there's something that talks about our plan. I can't remember if it says 5-year plan, but when you click on that, there are a lot of statements that have links within it. And there will be one that's talking about our crisis continuum of care. When you click on our crisis continuum of care, there's another link that you can click on that's for urgent cares. And it will go into detail as to where those are currently. What I can tell you is it's amazing, however, how it is changing daily. We get updates every month about a particular location and where they're at this particular point. So we have people right now that have found locations that they're renovating. We have people that are halfway through renovations. We have people that are opening next month. We have people that just opened. And so literally that is changing at least monthly in updating of where they're opening. We have a lot in the works. We have a lot that have recently opened, and we have many that right now that they had hoped to be able to open by the end of June. But because it can be really challenging in construction right now to get supplies, et cetera, they've bumped to July or August. But monthly it is changing in terms of locations that are opening. And you will see that ongoing over the next couple of years, that every few months there will be another location opening.
That's very exciting. There are no more questions in the chat so far, Commissioner. I know we still have a couple minutes. Is there anything else you would like to add about 988?
I would just like to say that this is just such an exciting opportunity and something that I feel like could be a real game changer for us as a state. In that, what we do know, if you're a person that is experiencing a crisis or, say, has a mental illness or an addiction issue, if you are in care or connected to care, your outcomes dramatically improve. The rates of suicide for person that are in care are dramatically reduced. But there are a lot of people in our state that are struggling with addiction issues and that are dying by suicide that have never connected to care. And what we want to do with this is to make it as easy as possible to take that first step, to connect with care. Because what we do know is that treatment works and you can have the life and recovery that you desire, and it is within reach. But because we feel like many people have not exactly known at times how to find this help, or when they've reached that moment that they're ready for help, how to navigate that. We really hope that this will break down many of the barriers that people currently have to finding that help. And so we really hope that through 988 we can intervene in many more situations so that we can have positive outcomes in those situations as opposed to negative, and that we also hope that this will enable many more people to reach out for this help and assistance that they need so that we can connect them with care close to them, that they can start that journey of living their best life.
Thank you. We did get one more question in. She says, this may have been answered, but will the youth crisis line still be available?
Yes, absolutely. The youth crisis line will still be available. And in fact, any of the lines that do exist for the most part. So say, for example, there is a gambling hotline. There is a veterans hotline. There are many, many hotlines that exist. What will happen is there's only one number you'll have to remember, and that is 988. And if ultimately you should go to the gambling hotline, they'll make sure that you get there. They'll make sure that there is not an immediate pressing need that overrides something first, because they'll manage that. But then they'll get you connected to where you need to go. Same with the youth hotline. That hotline will not go away, but you will also be able to reach youth mobile crisis and youth care through this hotline as well.
Thank you. We did get a question from Jesse that I think is along the same lines. How will children's response be integrated and impacted? I think that's what we want to remember, is that 988 is the...
Yes, and what I would say around that is, because we have done a lot of work over the last several years on the youth mobile crisis and the youth response throughout our state, we have been very careful that we do not want to disrupt or take a step back on that work in any way, shape, or form. But the other thing that we know about that work is that not everybody knows about that number or how to get that response. And so it really, for quite some time, will be dual. You'll have the same hotline that you know, but you'll also be able to get response through dialing 988. There may come a time, years down the road, where we don't need that other number anymore, because people will know that 988 is the way to access that, and we'll deal with that when the time comes.
Awesome. Thank you. I don't see any other questions coming through. I just want to thank everyone for tuning in. Thank you again, Commissioner, for being available this afternoon. And we will have future town halls as we get further down the road with 988. So thank you all for tuning in, and thank you again, Commissioner.
Thank you all so much for listening today, and thank you for your questions, and thank you for being part of the solution. This is the beginning of some tremendous things that are happening and can happen across our state, but it takes all of us. And we're just thankful that you tuned in and are willing to partner, and we hope that if you have a time, that you are able to avail yourself of these resources and have a positive outcome. And we're always grateful for any feedback that we have, and so feel free to let us know over this next year as things start to roll out how these resources have worked for you, because we want to have a continual process of improvement. Thank you so much for listening.